Hello, listeners. This is Dr. Chris Hughes again with a new podcast. Today we're going to talk about a very important topic that is unfortunately actually one of the major roadblocks to having a healthy mouth and a smile, and that is pain, fear, and anxiety related to actually getting dental care and going to the dentist. So anyway, what we're going to be discussing today is how pain, fear, and anxiety, how the pain, fear, and anxiety cycle can be broken with the use of sedation in dentistry. So we're also going to be talking a lot about sedation in dentistry and how that can help people break the pain, fear, and anxiety cycle. So as we get started here, let's talk first about what is the pain, fear, and anxiety cycle and what's the problem with it. There's probably a lot of people out there listening that may actually be able to relate to this. So this is how it works. Patient has dental pain, tooth pain, whatever, pain in their gum, whatever it is. Usually it's going to be tooth pain. And so do they go to the dentist. Unfortunately, they have a bad experience. Maybe they could not get numb enough. Maybe there was something in the procedure that the dentist did that they had pain with. In any event, they experience pain. Well, what happens next? Well, the pain generates anxiety. One of the main things that we all search to avoid in our lives is pain. And so if we have pain inflicted on us, not intentionally, but regardless, if we have a painful experience, we get anxiety over that because we want to avoid the pain. So patient comes in. They have a painful experience. They develop anxiety about the experience at the visit and after they leave. And the more they think about it, the more anxiety it generates after they leave. And that creates fear. So now we have somebody that becomes very fearful of coming to the dentist. So that leads to avoidance, which actually should have mentioned in our cycle. It's pain, fear, anxiety, and avoidance. So then the person avoids going to the dentist. They don't want to go back. They had a bad experience. They had a painful experience, created anxiety and fear, and now they're avoiding. So unfortunately, what happens is because they avoid, because they don't come back for even routine procedures, or actually more importantly, hygiene procedures, maintenance procedures, they come back, and now, because they've been avoiding going to the dentist, something goes wrong again, and they have pain, okay? Usually in these cases, the pain, the source of the pain is something more complex and more difficult to treat because by the time they come in, the pain is usually really, really intense because they've been avoiding. So now the problem is, from the dentist perspective, that now we have a person in a lot of pain, and usually the pain is associated with infection, and guess what? Our local anesthetics that we use in medicine and in dentistry do not work well in a painful, in an infected environment. So in other words, the numbing agents that we use to get a tooth numb, if the tooth is infected, now the numbing agents don't work as well. And so we try to numb the area, but it doesn't work as well. But yet the patient needs to be alleviated from pain. And guess what? That leads to another painful experience, maybe even worse than the first time. And because the patient can't get numb because of the effect of the infection in the tissues, which then amplifies the anxiety. The patient's already anticipating a painful event. Unfortunately, they're not disappointed in that, and this creates even more anxiety, which leads to even more fear. And it just goes on from there and there. The fear obviously leads to more avoidance, and we get the same thing over and over and over. And unfortunately, these people are very miserable with this situation. They have pain, they can't eat, they can't chew their food properly. That means that they can't get nutrition properly from good foods. Most really what we call good foods are foods that really require us to chew. The problem foods, which also cause more decay in teeth, are processed foods. And we've all heard about processed foods and how they're not good for us in terms of overall health with our diet. But they're also not good for us from the perspective of our teeth, because processed foods are soft, they break down easily, and they lead to more plaque accumulation, which then can lead to more tooth decay and gum disease problems. So it's kind of a vicious cycle in that way, because these people are now forced to eat more processed foods. They can't eat fruit, apples, carrots, lettuce, things like this. They can't chew because they're missing too many teeth, or the teeth that they have are too painful to chew with. And then it leads to this same sort of cycle, which is really a shame and affects a significant amount of the population. I don't have any hard and fast numbers, but I do know that only about maybe 50% of the population seeks routine dental care. And the other 50%, certainly a high percentage of that, maybe in the 30 to 40% range, don't seek dental care routinely because they are caught up to varying degrees in the pain, fear, anxiety, and avoidance cycle. Okay, so this is a big problem for people and in our general population. So the real question is, well, what can be done about that? How do we break this cycle? It doesn't seem like there's a good answer, because every time a person goes, especially if they're already primed to have a bad experience, or painful experience, they already have in their mind that's going to occur. So there's a lot of anxiety built up around that. And by the way, anxiety potentiates or makes fear worse. There's an interesting relationship there. And so the cycle continues. And like I said, if you think about it, pain and fear are intimately linked. The more fearful a person anticipates an experience to be, they will not be disappointed. They will have more pain, okay? Which, again, is unfortunate, but this is the psychology of how pain works. The other thing is people will tend to remember pain, whether it's in a dental office or whatever. They'll tend to remember a painful experience 10 times more than they will, unfortunately, a pleasant experience. So anyway, pain and fear are intimately linked, and they are certainly an intimate part of the pain, fear, anxiety, and avoidance cycle. So anyway, what can be done about that? Well, first of all, in the last 20 to 30 years, or even longer than that, let's say at least in the last 30 years, fortunately, dentistry has progressed quite a bit in just in general in understanding this problem and developing more effective local anesthetics. But also, local anesthetics can only do so much. We also have to think about the mind and what can be done to affect or relax the mind to help certain people with this pain, fear, anxiety, and avoidance cycle. So, what pharmacologically or with the use of medications can we do to help this problem, to help alleviate it? So, anyway, probably the first thing that people may think about, and which is, I would say, fairly common in most dental offices. I would say probably around 70 to 80% of dental offices utilize this technique. It's basically nitrous oxide. Many people call it, or it's been known by the nickname of laughing gas. It's a combination of nitrogen and oxygen, and it has an effect on people of making them feel more relaxed, kind of a little more dissociated sometimes from what's going on. In most cases, it really doesn't make people laugh. Again, medications, especially that affect the mind, a lot of how that medication works has a lot to do with what the person thinks is going to happen. This is not something unique just to nitrous oxide, but any type of drug that has an effect on the mind. What we're expecting can heavily influence how the drug actually performs or works. So in any way, in any event, nitrous oxide is a gas that's breathed. Typically, it's breathed through the nose. We put on what's called a nasal hood. Patient breathes that, and they feel they feel a little bit light. They feel maybe like they don't care so much as what's going on in their surroundings. Some people feel a little high. Some people feel at higher levels, their extremities get a little tingly. They feel a little floaty. And that's what nitrous oxide does. It's kind of what I would call your first line to help people relax. The only problem with nitrous oxide is people that have quite a bit of anxiety, it's just not enough for them. They need something more to settle them down and make them feel comfortable. And also at high levels for prolonged time, for more than, say, 30 or 40 minutes, in many people, nitrous oxide can bring on nausea and even sometimes vomiting. So that can be obviously another problem if the procedure is going to run more than 30 or 40 minutes. So another kind of basic thing that can be done is an oral sedative, in other words, a pill. A kind of a sleeping pill can be given to a patient. Now, typical pill that could be given to help a patient feel more sleepy would be Valium, Ativan, Halcyon, any of the benzodiazepines, which is a category of drug which causes sedation, can be used. Those are just a few examples of medications I've used in the past. You can give this to the patient the night before, help them get a good night's sleep, have them take it about an hour before, and you'll have an effect. Now, the problem with just giving the pill alone, let's say Valium, is that it's very hard to predict the level of sedation that the patient will get from that, or the level of calming effect. You may give it to someone who is 30 years old, who smokes, and who maybe dabbles a little bit with other medications, or that's already taking antidepressants or anti-anxiety medications, and you give them 5 milligrams of Valium and an hour before, and they're coming in and they're bouncing off the walls. I mean, it's as if the medication had no effect. On the other hand, you could give it to another person, maybe 60 years old, female, that's not taking any other medications. And this person could be very, very sleepy or falling asleep in the waiting room, which actually might be desirable. But the problem is that you gave the same drug to each individual, and you want something dependable. So, you don't always know. It can be a very much of a mystery how well that drug is going to work, but yet you want it to work well enough that it's going to achieve its end. So the problem is it's a little bit of a guessing game. And then, of course, the other issue is, let's say that the guy that came in that, he took the drug an hour before, and now, his appointment is 9 o'clock, and he took the drug at 8, and he's still wide awake, and he doesn't feel like he's even taken anything. You might say, well, just give him another 5 milligrams of Valium. Well, the problem is that it's going to take another 45 minutes for that to be digested, metabolized, pass through the liver, and then have an effect on the brain. And even at that, you don't know what 5 milligrams more is going to do. It could have a very little effect. It could have, or it could have a greater effect. But for a 9 o'clock appointment, then all of a sudden you have to think about starting at 10 o'clock, and that just throws the day off. So that's really not a good alternative, is redosing the patient. Now, another thing that can be done is you can do both a pill and nitrous. And in many patients, that seems to work fairly well. But still, you have the problems with potential nausea and vomiting. And the other thing is it requires that you have to use the nitrous, so you have a nasal hood over the patient, so it's a little bit harder to work on the patient. And still, in certain people, it can be rather unpredictable because not everybody responds to that. However, it is a fairly good technique, and it's used by more dentists, certainly more than just the nitrous alone. It's better. It doesn't require much in the way of advanced training to be able to do that, and it doesn't require any sort of special permit. And that's why more dentists tend to do that because it doesn't really require much additional training. We've talked about a couple of strategies. We talked about nitrous oxide. We talked about oral sedative or a sleeping pill. And then we've talked about combining those. So those are all good, but they're still not as good as what the best form of sedation is, which is IV sedation, also called IV conscious sedation. By the way, just so you know, we do all of these methods in our practice. So we do the whole spectrum. However, and we've been doing it for well over 15 years. Personally, what I've found is that IV sedation is the quickest, it's the most efficient, and it's the most profound, and it's the most predictable. And we're going to talk about why that is right now. So what is IV sedation? Well, basically, IV sedation is a technique where an IV catheter is inserted into a vein. We usually put the IV in. I usually put it in the hand or the what's called the ACF, which is kind of where the bend in your elbow is. There's usually a nice vein there. either way, we get the IV in and we start an IV drip. Okay, so we use usually what's called a ringer solution, which is a common solution used in IVs to introduce into the vein, and then we inject into the solution, the ringers. Through the line, we inject a medication that will make a person sleepy. And the great thing about doing it this way is that you have, with the vein, you bypass the liver and you might bypass metabolism of a drug, and it goes right to the brain. So when we inject a sleep medication, in most instances, we can see an effect within a few minutes, sometimes even within 15 or 20 seconds, because that drug is going to travel directly to the brain and have an effect, okay? So a lot better than trying to swallow a pill, because you're going to see the effect immediately. The other thing is because we can see the effect immediately, we can administer another dose according to what we're seeing. So, for example, we were talking earlier about the 30-year-old and the 60-year-old, and the 30-year-old taking a drug and not having much response, and the 60-year-old having a lot of response to it. So if we were to put those people on an IV and give them a sleep drug, what we would see is, with one dose, maybe one person wouldn't respond very well. So within a few minutes, we could give them another dose. On the other hand, the person that responds highly to the drug, we give them 2 or 4 milligrams of what we typically use is midazolam. We give that to them, and boom, they're already down. They're calm. They're sleepy. Their eyes are rolling back in their head, and they've drifted off into sleepy town. We know that we don't have to redose that person, and then we can go ahead and get the numb and start the procedure. So IV sedation is by far the most effective and the quickest way to get a patient sedated. And then, of course, the great thing is that IV sedation, the main thing about it is it helps break this pain, fear, and anxiety cycle. So, number one, the patient knows they're going to be going to sleep or be in a twilight sleep is what we frequently call it. And so that helps alleviate a lot of anxiety right off the bat. Then the other great thing is after the procedure is done and the patient comes around, the next day they're not going to remember much. Most sedation drugs have an amnesic effect. In other words, it helps you forget. So no matter what happened during the procedure, good or bad, the patient is unlikely to remember very much. And certainly if they don't remember much, then they don't have the fear and anxiety that's generated from a bad experience. So that's the other really great thing about doing IV sedation and using IV sedation medications is because it also helps people not recall what happened, and always the old kind of thought about, well, if a tree falls in the forest and no one heard it, did it really fall? Well, I don't know, but I think you get the idea. So one question might be, okay, well, IV sedation is so great. Well, why aren't all dentists doing it? Because probably only maybe, I would say, out of general dentists, I would say out of 100 general dentists, there may be 2%, maybe 1 or 2, and that's even stretching it, that do IV sedation. So the question is, if this is such a great form, why don't we see much more of it? And the simple answer is advanced training. It takes a significant amount of advanced training to be able to do IV sedation. In the state of Illinois, it actually requires a special permit. A sedation permit. So obviously, to get that permit, you have to demonstrate to the state that you've taken the appropriate amount of training, have done so many sedations in your training, have passed, of course, all the requirements to be able to do IV sedation, along with passing your ACLS, your advanced cardiac life support. Because when we get into IV sedation, we get into much more of controlling the patient's physiology. When we do IV sedation, it requires a much more rigorous and specific monitoring because although it's completely safe, it requires that the doctor that's doing the sedation, know exactly what they're doing. Because if they don't, you could get into some real problems. Certainly in well-trained and experienced hands, everything goes great, okay? But you always have to be prepared for things in sedation that, you have to be prepared to avoid potential problems. Certainly when patients are sedated with IV, their potential for their breathing can be more of a problem. When patients become very sedated, they become very relaxed, and their tongue tends to get loosened, and when they're reclined, it falls back into the back of their throat, and it can block their airway, okay? And so then that can compromise their breathing. If we have a breathing compromise, then we're not getting enough oxygen, then obviously we all know that can cause a problem. That can lead to other serious problems. So the dentists that are trained in IV sedation have a great deal of good training, or should have at least good training in how to manage these problems, how to manage airway, how to manage breathing. And along with other things, we monitor blood pressure. You need to know what's going to go on if you have a problem with blood pressure that's too high or too low. And also we monitor the CO2 and expired air and heart rate. So we all so as a dentist, your focus is actually to do the procedure. But when you're getting into IV sedation, and when you're doing the sedation, in other words, you're generally in medicine, an anesthesiologist monitors all that. But you're doing this in your private office, so you have to have good training, because as you're doing the procedure, you're actually monitoring the patient's their physiology. You're monitoring their breathing, their heart rate, and so forth. And you have to be constantly aware that those vital signs are well within a safe limit, in order that the sedation continues smoothly and that you can complete your procedure. If, on the other hand, there's problems with that, you usually have to actually stop your procedure that you're doing and make modifications to the patient's airway or medications in order to ensure that their vital signs stay in well within a healthy range to avoid any sort of emergencies. So this is why IV sedation, this is why 90% or 95% of dentists are not doing IV sedation, because it requires a lot of additional training and really experience too in becoming familiar with maintaining a patient's vital signs, maintaining them well within a good, safe range, so that there are no problems, and you're able to complete the procedure in a safe way. So anyway, the benefits, obviously, to IV sedation, like I said, are that, number one, you can sedate the patient fairly rapidly and fairly predictably. And number two, the patient tends not to remember very much from the appointment. And you do kind of see a wide range of responses to that. I've seen patients that barely even remembered coming into the parking lot before the procedure. I've had a few other patients say, yeah, I kind of remember this, but, it wasn't much. So generally, they remember very little to nothing, okay? And also during the sedation, patients will kind of go through a cycle. They'll go through more of a deep sleep, and then they'll come up a little bit. And as they come up, then that's when we give them a little bit more drug. We'll put them back into a more deeper sleep. Now, another thing that is worth mentioning is that this is what we call IV conscious, okay? So IV conscious sedation basically means that the patient is more in a twilight sleep. It's not the same as general anesthesia. That's an important thing to remember. Every now and then we'll say, we'll get people that say, well, I want basically like general anesthesia where, I don't want to know, I want to be completely out. And so the thing is that you need to actually have to go to the hospital and have an anesthesiologist do that because in general anesthesia, they take the patient very, very deep to the point that they are completely unresponsive and actually to the point where they can't even breathe on their own. You actually have to breathe for them and put them on a ventilator. Okay, so that's great for open heart surgery or, surgeries like that. But to remove a tooth or do a root canal or put a few implants in, that type of sedation is really not required. Because after all, you got to remember the patient's also numbed for the procedure. So anyway, general anesthesia is not something that is routinely done in the dental office, but IV sedation, IV conscious sedation, where the patient is still responsive. In other words, the patient can be sedated, but if you shake them or really talk to them loudly, they will respond. The best way to understand it is kind of like right when you're going to sleep and you're kind of in that kind of quasi dream state and drifting into sleep. That's what IV sedation is like. In other words, if somebody shook you or woke you, you would wake up. You wouldn't just lay there unresponsive like you would in general anesthesia. But at the same time, you would want to go back to sleep. And so that's the best way to describe IV conscious sedation is it's a twilight sleep. And the other thing is that it's used in conjunction with getting the person numb. So you get them numb, you do the IV conscious sedation, they're in their twilight sleep, you get the procedure done. If they come up a little bit and they start to wake up, all you do is give them a little bit more in their IV. They go right back to sleep. You continue your procedure and you're able to get it done. And guess what? They wake up the next day, they wake up at the end of the procedure. A lot of times they feel good, they feel rested, and the next day they don't remember anything. So it's a win-win for everybody. Some other really big advantages of IV conscious sedation is that you can keep the patient sedated for several hours. Getting back to talking about people on the pain, fear, anxiety, avoidance, pain cycle, a lot of these people just don't have one toothache. They have multiple dental problems. And that's another problem because often when they go to the dentist, they'll be one problem that gets addressed, but then there's like 4 other problems or 5 other problems that still need to be addressed. And so all of a sudden now we're coming back, 4 or 5 times and having to go through the anxiety and fear associated with that appointment 4 or 5 times. So that also keeps people away. Well, the great thing about IV sedation is you can get all those problems taken care of in one visit. And wow, isn't that great? So typically in my practice, when we're going to be doing a sedation, and by the way, we do a lot of sedation in our area. I believe I'm the only one that's doing IV conscious sedation that's a general dentist that does multiple procedures. So anyway, a patient maybe in our office, they may need, let's say, a tooth extracted, they may need a root canal, they may need an implant, they may need a crown. Okay, all those procedures, all those procedures need to be done. However, again, if we weren't doing IV conscious, you'd have to come back for all those procedures. But when we do IV sedation, we can keep the patient sedated 3, 4, even up to 5 hours, and we can get all those procedures completed in one visit. I usually tell patients we can get it all done in the morning because I typically like to do sedation and do longer procedures in the morning. So anyway, again, it's a win-win for everybody because you can get multiple procedures done all at once and not have to go through individual appointments. Certainly, for the working person too, it saves time. Time is a critical element today. We all work. We don't have time to take off multiple times to get multiple things done, even if we're not fearful. So this is another big advantage for people that need a lot of dentistry done to get back a healthy smile, to get rid of the pain and get back teeth in their mouth that they can actually chew and function with and enjoy their food again, instead of having to go through 5 or 10 appointments every week, every other week, 10 times over the next 3 or 4, 5, 6 months. This can be accomplished a lot of times in just one appointment, or maybe a couple of appointments or sometimes even more than that. But each appointment, we're getting multiple procedures done and making huge advancements instead of 10 half-an-hour appointments. It's far better to get, all those appointments condensed into a morning. The other thing is that once the patient is sedated and they're numbed, it's much easier actually for the doctor to get multiple procedures done. So it all goes hand in hand very nicely. People needing multiple procedures done, to have them sedated. Every now and then, patients that I know that the procedure is going to be long, even if they're not fearful, I'll recommend the sedation for them because the other thing is when they're sedated, they don't have a good handle on time. So, it can be hard to lay in a dental chair for 3 or 4 hours sometimes. So when we do the IV sedation, when they come up, let's say that it's been a 3-hour appointment, I'll say, now that you're starting to come around, how long do you think you've been here? And they'll say, well, maybe 20 minutes, 15 minutes. And, we started at 8 o'clock and it's now around 11:30. And I'll say, well, take a look at the clock. It's 11:30. You actually been here for several hours and, we got XYZ done. And, they're pretty happy about that. And like I said, frequently they leave feeling fairly good. They feel rested. Again, that's what we want to see. We want to see the pain, fear, anxiety, and avoidance cycle broken. And we want to see people happy and with their dental visits, and that multiple things have been accomplished at the same time to avoid multiple visits and multiple having to get numb and so forth. So again, it is a really great, wonderful technique that we do in our office to help people in this way. And I'm just thankful that I got the training and actually continue to train. It's a skill just like anything else. So as you progress, you learn new things, you get more training, and you even get better at it. But it's a great thing, and I highly recommend it for people that need multiple dental procedures, even if they just need a few teeth removed or treated, okay, and they're fearful. It's good for that. Another interesting thing about IV sedation that I found in my practice, and kind of wrapping it up here, is that it helps break that cycle, obviously. And I have a number of patients that, had this cycle going on, and they just needed something to break this cycle. So we used IV sedation. And but now they come in for their maintenance visits, and they don't need to be sedated for that. Or they might need a small filling. Because they've become accustomed to coming to our office, and they've become comfortable, and most importantly, they've developed a great deal of trust. They have overcome and broken the pain, fear, and anxiety cycle. And so that's probably the most rewarding thing of all, I should say, is that the IV sedation helps break that cycle so that actually they can become what I call kind of just a normal dental patient that doesn't need all the sedation. And they've learned that, going to the dentist can actually be a good experience. And that they have somebody in their corner that can help them maintain a healthy smile and healthy teeth and chewing ability for the rest of their life. So the idea is, certainly to use IV sedation or even other forms of sedation as a sort of an icebreaker to break the cycle, but eventually they get through that. The cycle is broken. They don't have the fear anymore. And now, just especially for maintenance or routine procedures, having their teeth clean, they feel good about the dentist and they feel good about coming back. And that is how the fear, pain, anxiety, and avoidance cycle is broken by using IV sedation. So I hope you enjoyed my podcast today. And I am Dr. Christopher Hughes. I'm at Hughes Dental Arts Center in Herrin, Illinois, on Route 13, near the intersection of Route 13 and 148 in the Logan Professional Park. You can contact us at, for more information, 618-993-3100, or you can go to hughesdentalartscenter.com. And you can learn more about our office, our procedures. Of course, we do a lot of cosmetic dentistry, reconstructive dentistry, implant dentistry. And of course, we do all that with IV sedation if a person wants it. And especially for the person who's looking to break the pain, fear, anxiety, and avoidance cycle, I invite you to come and check us out. So have a great day, and I look forward to speaking with you all next time.